Assalamu alaikum. Welcome everyone. Today we will study Measles virus, one of the most important human virus. Why? Because it remains a major cause of the illness and this beside the availability of an effective vaccine. برغم وجود vaccine لكن هو واحد من الأمراض الخطيرة still now. As a medical laboratory science students, our main focus will not only by understanding the virus itself, but also learning how to diagnose the measles accurately in the laboratory. During this lecture, inshallah, we will begin by discussing the virus classification structure, and then we will see how the virus enters the body, how it is replicate, and how it can cause a disease. Next, we will study the clinical feature, laboratory diagnosis, sample collection, molecular tests, serological tests. Finally, we discuss treatment, prevention, vaccine, and the important role of the laboratory during an outbreak. But remember that measles is one of the most infectious disease known in the human because of this due to this infectiosity. A rapid laboratory diagnosis is important to control outbreak and protect the community. Let's start to discuss our learning objective today. By the end of this lecture, you should be able to achieve 6 important learning objectives. First, you should understand the structure of measles virus, include the genome and the proteins that help the virus to infect a human cell. Second, we should explain how the virus causes disease and why it is and how it is weak and how it is weakening the immune system. And this immunosuppression is one of the unique features of these viruses. Also, in the third point, you should describe the stage of the measles infection beginning from the exposure until to complete the recovery. The fourth point, you should know how to diagnose the measles in the laboratory, including from selecting of correct sample, collecting it at the right time, and choosing the suitable laboratory testing to diagnose this stuff. Fifth, you should be able to interpret laboratory result correctly, especially in the vaccinated individual, young infants, and immunocompromised patients, where diagnosis may be more difficult. Finally, in this lecture, you should understand the prevention control different methods, including a vaccine, an infection control, and biosafety, and responsibility of the laboratories to report the confirmed cases to public health authorities to help in the prevention of the disease. By the end of this lecture, inshallah, you should be confident in managing suspected measles cases from the sample collection to laboratory confirmation. inshallah بنهاية هذه المحاضرة. Let's start why measles still matters. ليه لحد الآن برغم إنه في وجود vaccine الميزلز is still problem. That many people think measles is no longer a problem because a vaccine is available. However, this is not true. Why? Because measles continue to cause outbreak in many countries because the vaccination strategy not cover is incomplete. لأنه لحد الآن strategy vaccination not completed cover anyone. One reason measles spread so easy it is a high basic reproductive number اللي هي called the R0 or R0. R0 of measles اللي هي بنلقاها near 12 to 18 approximately. What does that mean? That means in one infected individual can infect it between 12 to 18 or 12 to 18 successful people in population with no immunity. And this mechanism or this spread of the infection is a few infectious disease take this way. Another important point why measles is matter is that patient become infectious before the rash it appear or before the diagnose. At this stage the illness look like common. بيكون فيها patient infectious, البيشنت بيكون عنده symptoms like a common cold, so patient often continue attending the school, the work, the public placing, unknowingly spreading carrying the virus وفي الفترة دي بيكون transmitted the virus to another person or spread the virus. Another important point is that patient another important point إنه more than 90% of hereditary immunity shot needed to interpret the sustained transmission. How to stop the transmission? We need more than 95% of population must receive a 2 doses of measles vaccine. عشان نعمل control للinfections أو to stop the transmission, we need 95% of all the population in the community must take a 2 doses of measles vaccine. If vaccination rate fall below this level, less than 95%, outbreak can be occur rapidly. This is a way the laboratory diagnosis is the most important. Every suspected cases should be confirmed quickly so that the isolation, contact tracing and public health intervention can begin immediately. أي كيس احنا شكينا فيها في اللاب فلازم نطلع نتيجة سريعة جدا ويكون عندنا نعمل immediately contact with the health public health to control an infection, to tracing a contact and to isolate the patient. Taxonomy and classification. Now let's look at how measles virus is classified. Then measles belong to the family called the Paramyxoviridae and the genus was called the Morbella viruses. It is an involved viruses containing a single strand negative sense RNA genome. Unlike influenza viruses, the measles genome is not segmented, meaning that it consists one continuous RNA molecules. Humans are the only natural reservoir for measles. Humans who are only natural reservoir for this virus. There are no animal reservoir and no insect factor involved in the transmission. This is very important to know because the disease with the only host species can potentially be eliminated through vaccination. دي حاجة مهمة شديد ممكن يساعدنا في elimination للديسيز أو eliminated للديسيز. Another important fact is that the measles has only one serotype. Measles and one serotype, for that the vaccine is suitable for the all genotype. Although scientists have identified many different genotypes, these genetic differences do not affect the vaccine. رغم إنه في عدد كبير من الجينوتايب حصل لها discover by scientists, لكن the genetic difference does not affect the vaccine production. The current vaccine protects against all circulating genotypes of the measles. Genotypes are primarily used by the laboratory to trace an outbreak to determine whether infections are imported from another country or spreading locally. For that we need the genotyping of the viruses in the infected person. Let's discuss the viral structure of the measles. The virus surrounded by the lipid envelope, which is obtained from the host cell during a viral budding. On the surface of the envelope there are two very important proteins. The first protein is called the H and another protein is called the what? F, اللي هي surface glycoproteins. It is function of H and F, H protein. It is important to attach the virus to the receptor on the human cell. It also the main target for neutralizing antibody produced after vaccination. What is this? This is the HDA. The second glycoprotein found is the F, اللي هو F protein or fusion protein. This protein allows a viral envelope to fuse with the host membrane so that the viral genome can enter a cell easily. Fusion protein also causes infection to the neighboring cells to fuse together, producing and these cells together fusing together and producing a large multinucleotide cells, and this is called the synergy. These are the characteristic findings in the measles infection. بنلقى إنه after الانفولد is this matrix protein which give structure support and have الانفولد اللي هو عبارة عن matrix protein give a structure support and help assemble new viron أو new virus particle. Inside the virus there is a helical nucleocapsid containing an RNA genome surrounded by nucleoprotein. Finally, measles does not have neuroamidinase like an influenza virus. نذكر كويس different between a measles and influenza virus. It has measles have do not have a neuroamidinase protein. It is important difference between a measles and influenza. This is a picture show the structure of a viron of the measles. In the right side you can see a transmission electron microscopic image. The microscope without color is the shape of the viron of the measles. إذا جينا اتكلمنا عن الجينوم organization and protein. Measles virus genome is approximately around 15,900 nucleotide long. It is contains 6 major structure gene arranged in a fixed order. عندنا 6 gene arranged in the fixed order. الجينز هي ال N وال B or ال V or ال C ال M ال F ال H and ال L. يبقى ال N ال B ال M F H L. N stand for nucleoprotein and the B اللي هي polymerase cofactor and the V وال C هم accessory protein. ال M standard for the matrix and the F fusion. ال H اللي هي agglutination وال L اللي هي large polymerase. These genes produce the proteins ال N وال B وال F وال L وال and ال H. ال M protein help to in the protect the viral RNA, while B protein assist in the viral polymerase and also produce 2 accessory proteins called the V and C. The V and C help the virus to evade when an immune response or to escape from the immune system. The M protein help in the organized virus assembly, while F protein اللي هي fusion help the virus to enable membrane fusion of the infected cells. And the H protein help the virus to bind into the host cell receptor. Finally, the L protein it is important because why? Because it's RNA dependent RNA polymerase responsible for the virus and size it's located in this gene. Because the genome is sensitive, the genome of measles is a negative sense RNA. For that, it cannot be translated directly into protein. Therefore, the virus must carry its own polymerase. For that, the virus carries its own polymerase inside every virus particle before it can begin a replication of it. Okay. How will viral replication cycle? A viral replication cycle اللي هي move or follow 6 steps. It starts from the attachment and inter-antral fusion. The third step is a transcription and the fourth step is translation. 5 steps is a replication and the last stage is assembly and budding. Let's see how a measles virus replicate. First, the virus attached to the host cell receptor on the cells using the H protein. After that, the F protein causes fusion between the viral involved and the cell membrane that allow the viral RNA to enter the cytoplasm. Once the viral RNA inside cytoplasm, the viral polymerase begins producing a messenger RNA. This messenger RNA after that are translated by the host ribosome into viral protein. Later, the virus produces a positive sense antigenome, which is here as a template for the making many new negative sense genome. The viral protein and genome are then assemble it near the cell membrane to get involved from the membrane. Finally, new virus particle leaves the cell by what? By the budding process or budding way, taking part of the host membrane that they are involved. The important point here is that the anterior replication of the virus occur only in the cytoplasm. Unlike other retrovirus, the Measles virus never enter the nucleus and does not have DNA stage. Let's talk about the viral receptor and the tissue terrorism. The ability of Measles virus to infect a different tissue depends on the two important receptors. The ability of the Measles virus to infect a different type of the tissue is depending on the two important receptors. The first receptor is called SLAM or CD 150, and the other receptor is called nectin for BVRL4. The first, let's start with the SLAM اللي هي CD 150. This is a receptor found mainly on the immune cells such as the T lymphocyte, the B lymphocyte, the macrophage, and the dendritic cell. After a virus entering through the respiratory tract, the virus infects these immune cells firstly. After that, these infected immune cells can carry a virus throughout the body through a bloodstream circulation. This process is called what? Is called viremia. Viremia, that means it's a virus in the blood. The second receptor, nectin-4, this receptor found in the epithelial, especially in the epithelial cell of respiratory tract and the skin. Infection of the epithelial cell causes the characteristic infection of the epithelial cell by this virus is cause characteristic rash and allow virus particle to be released into the respiratory droplet. This is explain why measles is spread so efficiently from person to person. Therefore, remember this in simple way. Remember this viral receptor and tissue terrorism simple. SLAM receptor, that means infection of the immune cell, and viremia and immunosuppression. And nectin-4 receptor, that means infection of the epithelial cell and the skin cell, lead to produce a rash and the virus shedding outside what a human by the respiratory tract, and patient become infected. Pathogenesis timeline. This timeline in this slide show how a measles develop after a person is exposed. It starts from day 0. Day 0, this is mean here the person exposed the virus through inhalation of infected respiratory droplet. After that, during the first few days, the virus replicated in the respiratory tract and near lymph nodes. Around day 5 to 7. The virus enter a bloodstream for the first time, spreading to lymphoid tissue throughout the body by the circulation. A second wave of viremia occur around days 9 to 11, to producing a fever and the typical symptoms of the measles اللي هي اللي هي منها rash. The characteristic skin rash is developed. Rash usually appear about 14 days after exposure to the infection. One very important point is that patient become infectious. وحاجة مهمة شديد إنه البيشنت become infectious 4 days before the rash develop. This make the measles very difficult to control because of transmission before a diagnosis. For the laboratory diagnosis, timeline is very important for diagnosing the patient in the lab. Why? For that, from this timeline, the most technique used in the early stage, we can use a PCR molecular technique, while an IgM antibody become detectable around the time of the rash appear on the skin. Understanding this timeline help you to choose the correct diagnostic test and interpret the laboratory result accurately. In this slide you can see development of different infection in the human host generalized model اللي هي start from day 0, incubation period, prodromal stage, acute illness stage, decline stage, and convalescence stage. When it is become acute stage, we need here the infection control protocol to implement it and strategic vaccine to implement it. Here in this color you can see from blue color to red color, this is developed, the patient become highly infectious from before the rash appear. Here we talk about what about the immune system to measles. Okay. When the measles virus enter the body, the immune system produces antibody and activated the T cell to eliminate the infected cell. The first antibody produced is an IgM. Well, IgM usually appear around the time of the rash development. It is highest level after about 1 week and gradually disappear within the 6 weeks of the infection. Because of this, the IgM is remain a marker for the recent or acute measles infection. Later after that, the body produces an IgG antibody, while IgG provided long-term production and usually remain for a life after natural infection or vaccination. One of the most unique features of this measles is something called immunoamnesia. Immunoamnesia, in this side, the virus, how we can define immunoamnesia? Think about the virus who start infected different immune cells, especially memory B cells and the memory T cells through the SLAM receptor and destroyed many of these memory cells. As a result of this destruction of the immune cell, the immune system forget the immunity that was previously developed against other disease. In this, that means after recovering from measles, a patient becomes more susceptible to the bacterial pneumonia, diarrhea, ear infection, and many other infections for weeks or even months. This immunosuppression is responsible. Immunosuppression بيحصل في immune cell حقتنا is responsible for the much the illness and many deaths associated with the measles. That means the immunoamnesia here mean it is a weak of the immune system. Weak of the immune system by what? By that measles is break and memory cells of the immune system. Okay. Transmission and infectious period. Measles is spread mainly through the airborne route. When an infected person cough or even talk, tiny respiratory droplets containing a virus are released into the air. This particle remains suspended in the air for up to 2 hours. This means when other person can enter the same room long after the infected patient has left and still become infected droplets are found in the air. Patients are infectious from 4 days before the rash appear until 4 days after the rash develop, because the transmission begin or start before characteristic rash appear. Many people spread the virus before they know have a measles. This is one reason why measles outbreak spread quickly. Usually remember that humans are the only natural reservoir for this virus, and vaccine coverage remain above 95%. Transmission can eventually be interpreted. ما تعمل vaccine percentage بتاعتنا كان actual covering بتاعنا كان أكتر من 95%, we can control the spread of the infection. Global epidemiology and elimination. Besides having an effective vaccine for many years, measles still remain an important global health problem. Why? Most outbreaks occur in the country where the vaccination coverage has a decline. معظم الاوت بريك بيحصل لنا في الكنتري حاصل فيها ديكلاين في البرسنتج بتاع الكفرج للفاكسينز للاريا. This decline may be caused by the armed conflict زي ما حصل عندنا في السودان، الحرب بتاعت السودان، ال poor health care accesses and the distribution of immunization program. في فترة الحروب، فترة ال poor health الحروب بيكون دايما في breakdown للimmunization program. To eliminate the measles from the all population, we need at least 95% of the all children receive 2 doses of the vaccine. When the vaccination rate fall below this level اللي هي 95, an outbreak can occur quickly. The highest mortality occur among the infants younger than 1 year and the malnourished children and the vitamin A deficiency children and immunocompromised patients. This is 4 population have risk for developing complication of the disease. For the laboratory professional, any laboratory professional from you, every confirmed measles cases contributed to the surveillance programs that help monitoring disease transmission worldwide. متى ما كان عندنا في اللاب عندنا case confirmed إنها بتاعت measles, contact the public health authorities to control a disease. Let's talk about the clinical staging of the disease of the measles. Measles develops through 4 clinical stages. First, incubation period, and the second, prodromal, الأقدامس, and the recovery. في incubation period, the patient always asymptomatic والvirus replicate locally into lymphoid tissue. This lasts from 7 to 21 days, typically 10 to 14 days. Abdominal stage هي patient have fever, cough, chorea اللي هي running nose, عندنا conjunctives, inflammation. In this stage اللي هي 3 to 5 days of the infection, patient have many clinical symptoms اللي هي photopia and the cup-like spot appears late in this prodromal stage. In the cup spot appear in the mouth. الإكزامينس اللي هي شنو هي عبارة عن الراش بتظهر لنا في السكين و begin in the hairline و behind the ears و spread to the face, trunk, columns and many area in the body. الريكفري اللي هي fever fall as a rash appear. recovery بيحصل لما يحصل appear a rash that is a fever become disappear and the patient become non-infectious. Cough may be persist for many weeks after infection. In this picture you can see different typical appearance of the people of the measles اللي هي children start infected, rash start infection اللي هي asymptomatic the first, and the prodromal اللي هي start by the when a cup-like spot appear in the mouth. Exams اللي هي rash appear on the skin and في حتى الريكفري الراش appear as crust بتظهر فيها شنو بتظهر فيها القشور وبتبقى تتقشر. طيب before the skin rash appear many patients develop something called the cup-like spot. This is considered it the pathognomonic of the measles اللي هي واحدة من الحاجات المهمة جدا في التشخيص حق الميزز, meaning they are highly specific for measles. A cup-like spot appear tiny, flash, white dots in the mouth, usually opposite دايما بتكون في عكس المولار teeth أثناء الطفولة. Many people describe them as the grain of the salt on the red background. Usually appear 1 or 2 days before the skin rash appear. Because they disappear quickly, clinician must examine the mouse early in the illness. لأنها بتختفي في الأيام الأولى، لازم الكلينيشن البداية يعمل لها examine. Recognizing لو شفنا cup-like spot in the mouth of the children, although this is a help a clinician to diagnose or to suspect the measles before a patient becomes fully symptomatic. Here it is differentiated between الكوب-لايك والميزلز rash which appear. الكوب-لايك اللوكيشن بتاعها بيكون وين inside البكال ميوكوزا. هي الميزلز rash on the skin. appearness in the few days of the infection 1 to 2 days. هي red هنا after 3 to 5 begin after 3 to 5 days after a fever start. A duration may be lasts about 1 to 3 days اللي هي rash lasts for 5 to 6 days. cup-like spot, it is the most important pneumonic highly characteristic for the measles. هي characteristic measles rash is characteristic but it is resemble or similar to other rash caused by the other viral infection. For that we cannot able to differentiate it from the other rash caused by the other viruses. Type complication, most measles patients recover completely from infection. However, that there are some complications may be occur and can be serious, especially in the young children, adult, pregnant women, and in compromised patients. The most common complication generally is otitis media or middle ear infection, diarrhea, dehydration also common. They leading to this. The one of the most leading of this that infected children. It is a complication or another infection like a pneumonia. Neurological complications include the serious and the acute encephalitis occur usually in one of the patient per 1000 case. يعني كل الكومبليكيشن بتاعت neurological complication بتاعت السنة دي بتحصل ل 1 person كله 1000 cases. Vitamin A deficiency increase the risk of the eye damage including corneal ulceration and blindness. For pregnant women have a high risk to increase the miscarriage and the premature delivery and severe pneumonia. Also there are complications of immunocompromised patients like development of a subacute sclerotic encephalitis والMIB in immunocompromised host وtransit immunosuppression اللي هي leading to what secondary infection like which you say a pneumonia. Remember that in many complications occur because the measles weak or destruction the immune system allowing that secondary bacterial infection to develop. A severe lead complication like what? Like a subacute sclerotic encephalitis or measles inclusion body encephalitis. The first is subacute sclerotic encephalitis. This disease usually develops after 6 to 12 to 15 years after natural measles infection. Why it is occur? It is occur because the defective measles virus remain inside the brain for the many years. Where patient gradually develop changing develop personality change, power school performance, memory loss, and message called it myoclonus and serous and eventually lead to the severe neurological disorder. Also, LSVS is usually fatal. It usually lead to death among these children. The second condition here, measles inclusion body encephalitis, will usually occur in the immunocompromised patient. This is developed after 1 year of the infection. Measles in a special population, this is called it above. Not all patients develop measles in the same way. Some group are the much higher risk to severe infections and the complication. First group, which we will say it is infant younger than 1 year, and a pregnant woman, and immunocompromised, and the malnourished or vitamin A deficiency. Diagnostic strategy. How we diagnostic? Okay. Now we move to one of the most important section of this lecture, اللي هي laboratory diagnosis. We accelerated you. Before testing begin, we need to classify patient to 3 cases: suspected cases, probable cases, and confirmed cases. What we mean by suspected cases? Suspected is a patient with a fever. Any patient with fever and generalized popular rashes and at least one of the following، اللي هي عنده واحدة من الأعراض دي، اللي هي الكف أو الكروزي أو الكونجنتيف. This is called the suspected cases of measles. أما probable cases هي suspected cases that had contact with a confirmed measles patient. أما confirmed cases, this is case it require result or evidence from lab it positive for the measles virus. We can be may be positive by the detectable IgM, or positive by PCR, or positive by virus isolation, or positive by an IgG seroconversion between period of the serum sample. For every cases from the above these cases, a laboratory should be collected both respiratory sample and serum sample. But remember that the PCR is the most technique useful for the early diagnosis of the measles infection, whereas the IgM become positive after several days. For that, we use IgM after 5 from the start of infection. Correct sample collection and timing are important as choosing for the correct laboratory test. The general samples. A correct sample collection is essentially for the accurate diagnosis. The first sample, it is a serum. Also we can collect the throat swab or nasopharyngeal swab, urine, or a CSF or a tissue. Serum IgM or IgG اللي هي at the first contact اللي هي if negative less than 3 days, we repeat it after 3 to 10 days. A throat swab or nasopharyngeal swab, we take it from 1 day to 3 days of the rash, it be positive. And the urine 1 to 3 days of the rash, and the CSF or tissue when suspected epidemiological or atypical cases, we can collect the CSF or a tissue. That a serum is used to detect the IgM or IgG antibody. If a serum is collected during the first 3 days after rash appear, that means the IgM will still be negative. In this situation, another sample we should be collected after the 3 to 10 days later. For a molecular diagnosis, we prefer to use a nasopharyngeal swab or a throat swab to use what for the PCR. The samples usually contain the highest amount of the viral RNA during the first days of the infection after rash onset. Another samples we can use the urine or virus isolation. We can use the urine. الفيروس infected cells are shed into the urine. warfare total urine اللي هي بنلقى ان الفيروس بيحصل له shedding through urine, making it an additional source of the PCR. For the patient of have a complication, we can use a neurological, we can use a CSF or a tissue sample. Interpretation of a serology result. The serological test means that measure antibody of the patient response. Let's begin with the IgM. IgM is the first antibody produced after infection. Once in positive IgM, that means that positive IgM usually indicate recent or current measles infection. However, timing is very important when it collected the sample. لو احنا أخذنا السامبل أخذنا السيرم بتاعنا is collected too early, maybe it is a negative, and the IgM may not be detectable in this time. This can produce a false negative result. In these cases, we need to repeat again. Testing is recommended for the 30 days later. After that, after develop of the IgM, the IgG is developed. A single IgG positive usually means that the patient had immunity from the either previous infection or vaccination. لما لقينا التست بتاع الاي جي كان positive one positive, that means إنه patient عنده previous infection or vaccination. It does not use for the diagnosis of acute measles. To confirm a new infection by using an IgG, we need either seroconversion from negative to positive or a four-fold increase in antibody level between paired serum samples of an IgG. You can put in mind that recent vaccination and measles, mumps, rubella vaccine can also produce an IgM, so that vaccination history must always be considered during the interpretation of results. لأن الفاكسين بتاع ال MMR can reduce ال IgM. For that we need to take a history of the vaccination to interpret the result correctly. في molecular testing هي the gold standard for early laboratory diagnosis of the measles. This is detect the viral RNA direct in the sample. It is more sensitive during the first few days after the rash appear. It's preferred to use a sample, another angle swab, or a throat swab, or a urine swab. Usually we use a PCR in the early infection before antibody develop, or in immunocompromised patient where there is no immune system developed, or in an outbreak investigation. After confirming infection, laboratory may perform genotyping. We need a genotyping to identify genetic lineage of the virus by sequencing part of the nucleoprotein gene of this virus. This genotyping helps public health authorities to determine whether cases are linked and whether the virus was imported, virus جاء من وين, whether a local transmission is occurred. Remember that genotyping does not affect the treatment or vaccination selection because for that all genotype, because why? Because in all genotype of measles it is belong to one serotype. For that we are not needed genotyping for the vaccination, to select a vaccination or to choose a treatment. Virus isolation هي الكالتشر رابيد ميثود. Historically بنلقى إنه measles virus could be grown in different cell culture. Okay. However, a virus isolation is rarely حاليا بقى virus isolation is rarely performed. Why? Because the culture it is slow, technical, difficult, less sensitive than the PCR, more expensive. The laboratory mainly use the IgM and the ELISA, IgM, ELISA, and the PCR. Some laboratory also confirm the IgG avidity testing. A low avidity IgG usually indicate that is a recent infection, whereas the high avidity of an IgG suggested a past infection or previous vaccination. This is the most important information, put it in the mind. Immunofluorescence assay also may be used in some specialized laboratory. Over all of this serological or a cultural technique, PCR remains the most suitable laboratory method for confirming an acute measles. This is a laboratory laboratory workflow and biosafety. This slide summarizes a complete laboratory workflow. اللي first laboratory receive samples from suspected patient. After that, the serum and the respiratory sample should be collected. Samples are proceeded according to the laboratory protocol which is available or technique. A serum separated while the respiratory sample remain in the viral transported media. مهم جدا. Testing is then done. Usually IgM, ELISA and PCR are requested together by they provide complementary information. دائما بنحاول البيشنت نشتغل له ELISA ونشتغل PCR together to provide a complementary information. Results should always be interpreted by this result interpretation by the basis or link it to a symptoms onset, vaccination history, and clinical finding. Type example of the result interpretation scenario. Example in case 1, a patient present on the first day of the rash, IgM is negative but the PCR is positive. That means the patient in the acute measles. Case 2, patient developed fever and rash 8 days after receiving an MMR vaccine, an IgM positive. This is mean vaccination. This is may be properly vaccine-related immune response rather than wild-type measles or infection by the measles. For that, vaccination history is very important to take information from the patient all the time to get a vaccine. Case 3, a immunocompromised patient has a mild rash and negative IgM and PCR is positive. This is patient is positive for what? For the measles. Why? Because the molecular testing is much more reliable than an antibody for the immunocompromised patient. Well, immunocontact اللي هي patient contact person with a patient اللي هي exposed and exposed healthcare worker has a positive IgE but no symptoms. This person already has a protective immunity and not require further testing or the isolation. This is examples of the different results which faced in the lab. Reporting and public health notification. This is the most important point in the control of the measles. This means that a health care provider and laboratory must report suspected or confirmed cases immediately to the public health notification. Do not wait all the laboratory results before informing the public health authority. An early notification to public health authority allow this health official to begin contact tracing, isolation the patient, vaccination of susceptible to contact, and outbreak investigation. When you report to the health authority, reports usually include the date of rash onset, sample collection, type of the sample which you collected, and date of the sample collection, vaccination history, and the laboratory result. Accurate documentation improve disease surveillance and help to prevent the further transmission of this disease. Treatment and supportive care. There is no specific antiviral drug approved for the routine treatment of the measles. Management is mainly supportive only. The most important treatment recommended by the WHO is vitamin A only. Vitamin A decrease or reduce disease severity, while eye complication or mortality. Patients also receive adequate dehydration, nutritional support, and treatment for the high fever. Secondary bacterial infections such as pneumonia and otitis media should be treated with operated antibiotic of this bacteria. A patient with a severe complication include pneumonia, encephalitis, dehydration, or severe malnutrition. This patient should be hospitalized in the hospital, not stay in the home. Rifampin this antiviral has been used in some severe or immunocompromised patient, but is not recommended for the routine cases of the measles. The main goal of this treatment to prevent the complication while البيشنت immune system أثناء ما الميزز بيعمل clearance للفيروس. How we can prevent the measles? The best way to prevent the measles is a vaccine. There are no way. The best way is the vaccine. The most important vaccine is MMR vaccine, which this vaccine protects against measles, mumps, and rubella. Also, there are other vaccines. MMRV vaccine is also include protection against varicella or chickenpox. Two doses provide about 97% protection from this infectious virus. The first dose usually between 9 to 12 months, depending on the national vaccination schedule, and the second dose ensure a long-lasting immunity in individual who did not respond to the variant dose. هي بتدينا شنو؟ السكند dose بتديني مناعة طول العمر الدوز الأولى ما عملت لنا strong immunity. Because the vaccine contains live attenuated virus, it should not be given to pregnant women or to patients with a severe immunodeficiency. Common side effect of this vaccine may be few fever, mild rash, and usually resolved without treatment. Maintaining at least 95% of vaccination coverage is essentially for to control or to prevent an outbreak and keeping the measles elimination from the area or from the population in this area. طيب البوست exposure and prophylaxis outbreak control اللي هي after exposure to measles disease can sometimes be prevented. بعد ما تعرضنا للميزوس ممكن بعد ذاك يحصل كنترول ضمنه للانفكشن او للديزيز. If there is a person suspected is exposed to the vaccine to the measles, it can be used one dose of MMR vaccine within 72 hours when possible. For the people who cannot receive the vaccine, such as the pregnant woman and infant immunocompromised patient, we can give it human normal immunoglobulin should be administered within 6 days of the exposure to those infected person. During an outbreak, a confirmed patient should be isolated from 4 days before until 4 days after the rash appear. A public health team should identify close contact and vaccinated those who are susceptible to get an infection. A rapid confirmation, it is important to control a disease because it allows public health authority to implement the control measure quickly and limit the further spread of the infection. Let us finish by reviewing the most important point from the today's lecture. Measles is one of the most contagious viral disease. Humans are the only natural reservoir of this virus, making a global elimination possible through vaccination. The virus initially infected the immune cells through a SALM receptor, causing viremia and temporal immunosuppression. Then is spread to the epithelial cell through a Nectin-4 receptor, producing a rash and allowing virus to shedding outside the human body. For a laboratory diagnosis, remember this point: collect both serum and respiratory sample. PCR is a suitable test during the early stage of the infection, while IgM is usually useful after the rash develops. Usually, interpretation laboratory result together with the sample time and vaccination history and the immune status of the patient. Finally, there is no routine antiviral treatment for the measles. The most effective strategy is prevention through vaccination, rapid laboratory diagnosis, immediate cases reported, and strong public health surveillance. Thank you for attention. That is all of the measles today.